Hello, everyone. Welcome to podcast for week 9. This week's podcast is on the end of life care, hospice, death, and dying. As a physical therapist working in palliative care, it'll be helpful to know some physiological signs of approaching death. The multi-system physiological signs of approaching death could be from the central nervous system, which could be confusion, reduced responsiveness, and anxiety caused due to hypoxia, metabolic imbalance, and adverse effects of opioids. Musculoskeletal signs, which could be weakness, loss of function due to progression of the disease. Cardiopulmonary signs, which could be reduced blood pressure, irregular heart rate, and a variable respiratory rate. Integumentary signs, cool and clammy skin due to loss of cardiovascular perfusion. Gastrointestinal signs, which is loss of appetite, altered bladder and bowel movements due to possible adverse effects of medications. I also thought it would be helpful to explain the difference between care in a hospice versus that in palliative care. A hospice provides a specific set of services provided to those who have a physician determined prognosis of less than 6 months, and the patient or their family acknowledges that they're no longer seeking curative care. Versus palliative care is broader in scope, including patients at any stage who may be even seeking curative care. The role of a physical therapist in caring for those at the end of life. The case scenario of Thelma, aged 78, in chapter 27 in our reading test, is an excellent example that speaks volumes regarding the relevance of care from a physical therapist even at the end of life. Due to lack of time, I would not go further into it, but would encourage you to read it from the text. The physical therapist could act as a clinician, providing modalities for symptom relief, hands-on treatment, assisted exercises to maintain ability in activities of daily living, and thus ease burden on the caregiver. The physical therapist could be an educator. Three-dimensional roles there: educating the patient, family, and the caregiver. Could be a counselor that practices active listening, skillful communication, and express oneself with clarity and sensitivity. Physical therapist could be a team member and thus facilitate team interaction. Pain management is an integral part of care at the end of life, and I found it worthwhile to include a brief explanation about pharmacological measures adopted for pain control. They could be non-opioid analgesics, opioid analgesics, adjuvant analgesics like antidepressants, anticonvulsants, corticosteroids, local anesthetics, and calcium channel blockers. Also, palliative sedation could be given. Palliative sedation is to induce sedation to alleviate conscious awareness of pain. The questions for this week are: as a physical therapist, what strategies would you use to motivate a patient who is at his or her end of life to do the best they can to actively participate in their care? Palliative care, develop an attitude of empathy, and eventually become good counselors. It just happens automatically by virtue of the job they are in. Is this statement justifiable? Explain your rationale. These are my references, and thank you.